On Wednesday, September 17th, the Centers for Disease Control launched a national campaign at United Medical Center to encourage people to be tested and treated for HIV. The CDC's Dr. David Purcell explains.
HIV Treatment Works is CDC's newest Act Against AIDS campaign. It encourages people living with HIV to get into care, start taking HIV medications, remain in care, and adhere to their treatment. It is CDC's first campaign focused exclusively on encouraging care, treatment, and retention in care for persons living with HIV. It is our goal that HIV Treatment Works will improve the overall health of those living with HIV and reduce the risk of transmitting HIV to their partners by providing access to information and resources that will help increase the proportion of people living with HIV who enter and remain in care and achieve viral suppression.
The director of the White House Office of National AIDS Policy, Douglas Brooks, says the HIV Treatment Works campaign is all about prevention and care.
I think it's important for people to know, for people in the community, for the media to understand that the people who are working, in this case at CDC, who are working across HHS, are working diligently and listening. This campaign and some of the work that we're doing, we've been screaming for a long time, we need to integrate prevention and care. We need to integrate prevention and care. This is a perfect example of the integration of prevention and care, and the community and our government listening to our request to do things that we think would work well for our communities.
There are a number of reasons the CDC chose to roll out the HIV Treatment Works campaign in D.C. rather than other cities, according to the CDC's Nicholas DeLuca.
Well, Washington, D.C. has been an important place for us since the beginning of the campaign. We have several of our federal partners here, but we also have several members of our expert steering committee that are based here in Washington, D.C. Many of our partners, our national partners, have headquarters here in Washington, D.C. as part of our Act Against AIDS Leadership Initiative. We're really pleased to be here today at the Medical Center, too, as well, right here in Washington, D.C., to be able to roll out this important campaign. Well, we know here at the Medical Center that you all are leaders in HIV testing, HIV care, HIV treatment, and we knew that it would be important to come in here into the community and to be with all of you to be able to emphasize the importance of this type of an effort for people living with HIV and AIDS. We're not only trying to reach people living with HIV and AIDS, but also healthcare providers who serve persons living with HIV and AIDS, and we know that you all do a stellar job of that here at the Medical Center.
Vernil Batts and Christopher Barnhill, two HIV patients, participated in a panel discussion to talk about how they contracted HIV and how they were being treated for the virus. Batts became infected with the virus from intravenous drug use, and Barnhill was born with HIV. Dr. Nimdi Elias is the medical director of Community Health Initiatives and director of the Care Center at UMC.
Well, the data does show that Ward 7 and 8 have some of the highest prevalences of HIV within the District of Columbia. It's also a place where we have high morbidity and mortality from several diseases, diabetes, hypertension. And so the fact that this was launched at UMC is extremely relevant, extremely timely, because this really is almost a hotbed of HIV within the city. Treatment Works focuses on two populations, the HIV negative and the HIV positive. It focuses on the HIV negative because people who are treated are less infectious and there's less chance of transmitting the virus. It focuses on HIV positive because if they're treated, they have a better chance of living well. And so given that HIV is still very prevalent in the US and about 20-something% of people do not know their status, HIV Treatment Works is extremely timely.
United Medical Center CEO David Small.
HIV/AIDS is a top priority for Washington, D.C., and certainly for UMC. So we're very happy that as they rolled out this particular initiative, the next iteration, if you will, of getting the message out to folks, that UMC's been able to be part of it because of our long-standing history with it. We have a long-standing commitment to increased testing for all patients who come to our campus for various medical reasons, and getting those individuals who test positive into care as rapidly as possible. And secondly, we've been very fortunate to team with not only grant funders under the Ryan White grant, but also Gilead, to have the latest generation of lab testing equipment that allows for the most rapid testing and the most advanced early detection of the HIV virus.
UMC's chairman of the board, Bishop Charles Hudson, said we must show empathy towards those who are hurting.
It's a blessing to be here, not only as the chair of the board, but I'm a pastor, and I always like to apologize for any colleagues that I have that are practicing spiritual malpractice, and that is all of our jobs is to care for those persons who are hurting, and it doesn't matter what hurts them. We want to be able to care for those who are hurting.